Hi, everyone. I'm really excited to be here with two clinical psychologists from South Africa who are going to be discussing using a neurodiversity affirming approach with patients and also some special topics like autistic burnout. So maybe just to get started, we'll ask, how did you become interested in this line of work and in working with autistic individuals in particular?
Okay. Well, thank you very much, Sam, for having us on the podcast. Firstly, it's a great opportunity. Um, I think how I got working with clients on the spectrum is that I saw a few clients a few years back. I've been working in the field for about 20 years, and I saw a few clients that were on the spectrum, took them on, and realized they were quite different to working with neurotypicals. These were clients that really wanted to get to know me as a person. They would ask me questions like you're asking me now, how I got into this field. They wanted to know me really as a person. I liked that type of personal human touch and having that being able to answer those approaches. Whereas neurotypicals often didn't want to, sort of get to know me as a person. They really resisted that a lot, and they wanted me to remain in the role of just being, the therapist. So that was quite nice to me. I found that very interesting, and I found the work with them very stimulating as well. They were very committed to the process of therapy. And they oftentimes, they were more compliant, I think, with the tasks that I gave them, and I enjoyed that, and I think I realized as I kept working with them that I was in a new frontier here. Like this was work that was evolving, and it was very new. It was not like work with neurotypicals. We were having to make up some of it as we went along. So that's some of the reasons why I got involved with neurotypicals and with neurodivergent people, and why I've decided to specialize in working with autistic spectrum disordered individuals.
Thank you.
Okay, from my side, yes, I've also been a clinical psychologist with, like Kevin, working with a whole diverse range of clients for over the last 20 years. And probably about 5, 6 years ago, we also got quite interested in neurodiversity. And at the time, we opened up the Spectrum Center and started specializing exclusively in adults with being on the spectrum. There's a lot of work done for children, and we just felt that there was quite a big need for people, specifically with adults, diagnosing and treating people that's on the spectrum, that's adults. So yeah, I mean, it's been probably from all the work I've done, probably one of the most rewarding works, meaning it feels like you really make a difference in people's lives. Working with adults that has been spent a lifetime on the spectrum, not understanding what's going on, then giving them a diagnosis, working through it, it really feels like you make a real difference in people's lives. And from a psychologist's perspective, it's rewarding. It's nice to work and feel like you really make a difference. So since then, became quite passionate about it as well. Working with adults is a new field, like Kevin said. So we are making things up as we go along. We're working, trying to fit it into the psychology models and creating new psychology models. It's new work that we do enjoy working. And yeah, working with them, I think it's like Kevin said, it's people that is very straightforward, very authentic. You learn to be very authentic in therapy, which is a style that I really enjoy working with as well. You don't understand authentics until you work with people that's on the spectrum to understand what is real, how they see the world as well. So yeah, it's been great. It's been a very interesting journey learning more about neurodiversity and being able to help people. So yeah.
Thank you both so much for your answers to that. I think it's a really interesting perspective that you both have, and one that I wish more clinicians
Mm.
shared. One question is, in your work, I know previously when we were talking, you mentioned that you've worked a lot with late diagnosed autistic individuals. What are some unique needs that you found late diagnosed individuals tend to have?
Well, Sam, I think if someone's late diagnosed, they've obviously waited or had to wait to get the diagnosis for various reasons. So you're talking about people probably in their late 30s, early 40s, into the 50s as well, receiving a diagnosis. So they've waited, or didn't have the finances or whatever it is to pay for the assessment. But I think what the needs of them are is quite different to someone that's diagnosed quite early because, at that point, they're at a certain phase in their life. And I think the reaction to getting a diagnosis at that point is almost heightened in a sense. So normally, I mean, most people would experience some degree of relief right up front when they get them. Most people that receive the diagnosis will experience relief. So they have this honeymoon period where, they feel relieved, everything feels good. They finally got an answer to why they behaving or acting the way they are. But in some senses, at some point, they feel anger, they feel confusion, and there's a sense of anxiety, like what's now, what's next? And that's heightened. I think you see heightened levels of anger sometimes in individuals that are late diagnosed, heightened levels of anxiety, heightened levels of confusion. And there's a grieving process, they go through a grieving process much more than people that are diagnosed early because they're grieving for what they didn't get. They're grieving for what they didn't know. They're grieving for the life that they could have had if they'd known they'd had the diagnosis. And what are they going to do now going forward with the life that they have now that they have this diagnosis of being autistic? So I think what they need at that point is, and again, it may not be the immediate thing that someone on the spectrum thinks that they need, but it's actually support from other neurodivergent individuals, actually, from other people on the spectrum that have probably been there or had the diagnosis for a while. So they need that sort of support. And so they should seek out support from an online. It doesn't have to be in person. It could be online. They could seek out support in a support group, either online or face-to-face. Get to know other people that are, on the spectrum. And then the other need, I think, for them is to do their research and, study around autistic spectrum disorder, because they would need to find their authentic autistic self eventually, because they've been masking for probably for so long. The degree of masking will vary in every individual, but most of the adults we see have high levels of masking, so they'll have to find out how they're going to express or exhibit their specific autistic self to others going forward. So, those are the kind of needs I think people would have when they're like diagnosed, and also to be patient. That's not easy for sometimes when you're on the spectrum, but I should just be patient with yourself and patient with others as they come to terms with having this disorder or having autistic spectrum disorder, and give people a little bit of grace. They will get around, and give themselves a bit of compassion. They will get around to accepting it and coming to terms with it in time. So it's those kind of things. And then, if they're still struggling, they're probably going to need some, support through. I would really encourage people to seek out a professional that has a specialization in treating people that are neurodivergent, rather than seeing just a, quote unquote general practitioner, someone that doesn't specialize in it. Because it helps to see someone that has knowledge of the disorder and how to work with it therapeutically. So yeah, that's what I think.
Yeah. Thank you so much for that very helpful answer. And I especially appreciate the point about finding a community of other neurodivergent individuals. That can be so helpful with combating isolation and just developing understanding, as you mentioned. The next question is one I'm especially curious about, which is you both mentioned that you have a lot of experience supporting autistic individuals experiencing burnout. Would you be willing to share a little bit more about that?
Yeah, that's a big topic. And often what happens with it is that individuals that experience burnout then eventually start seeking the late diagnosis. And often when the people come to us as they are either being burnt out already, or they're in the process, or they're somewhere along the line of experiencing burnout. And it's at that stage that adults then reach out and realize, listen, I'm not coping, been trying to do this. So we often find them at that stage of burnout or somewhere on the line of burnout, by the time they sort of get to us. So the experience of working with that, yes, it's like Kevin said, the very first step with that is obviously to confirm the diagnosis. Um, you know, the diagnosis is quite important. Now, often, we've been criticized for labeling people. Other professionals don't like people being labeled. They say, what does a label mean? But I differ from that because it's very important to name it, to understand what it is that you're working for, to be able to get a reason for and understanding why, some of the struggles they had their whole life. And then, of course, working with acceptance of that diagnosis, which is an entire journey where people sometimes need to integrate their past with the present and then the future. How I'm going to make sense of this going forward. We then work a lot with understanding what is autism, which is takes a long sessions. It is not what people think it is. And although people that's been on the spectrum have experienced autism, know exactly what it feels like being autistic, what we do is we try and put autism in relation to neurodiversity to try and understand what is the difference, how does it work, why do we see the world different? Because I think everybody has got this idea that if I see the world in a specific place, everybody must see it like this, and often trying to understand the two different worlds. Now, this is not for people to try and fit in and to be more neurotypical. But very often, when we need to understand things, we have to understand it in relation to something else. And very often, when you compare the differences to them, what is neurodiversity? What is neurotypical? What's the differences? And that relationship and their own unique presentation makes a lot of sense for people. So yeah, it's and then afterwards we work out a very specific treatment plan for people. So it's a diagnosis, accepting it, which is a whole process as well, understanding what is autism, that's a few sessions as well. And then a very specific treatment plan, meaning people that's on the spectrum enjoys having a specific plan. They like technicalities, they like factual stuff. You got to give them a plan. They want to know how to go forward. How are we going to treat this? So okay, I'm autistic now. What now? So very often it's a little bit more specific, which is very different to normal neurotypical work. What is neurotypical for neurotypicals by neurotypicals? It doesn't always address all the needs of someone that's neurodiverse. So yeah, it's often people try to cope, get to a stage where they experience burnout and then feel, let me reach out there. I've always had this suspicion over many years that I might be on the spectrum. And this often then gives them part of that solution that they need at that stage of burnout to be able then to cope. Yeah.
Thank you so much for that answer. And may I ask, what are some kind of common signs of autistic burnout? And how do you distinguish between autistic burnout and depression?
Well, the thing is, that's a very interesting question, purely because burnout itself is not a clinical diagnosis according to our DSM yet. Although autism burnout is very real, it's a very serious condition. It is something that deserves far more research that we have at the moment. So the only and the closest thing that we can really compare it to is really depression. Now, neurotypical burnout is seen as a form of depression, and autistic burnout presents very similar. So we treat it as a comorbid condition. So we look at depression, and we look at other comorbid conditions, anxieties, generalized anxiety disorder, and we try to treat it as a whole. So the presentation is similar to autism. So you can think of severe burnout. Severe burnout is the same as severe depression. So it is a normal presentation of chronic exhaustion, for example. People that feel tired, even if they do rest, you can go sleep and you still wake up feeling tired. They wake up in the morning and even having to do simple tasks can become quite demanding for them, where they're just getting out of bed, having a shower, really starting to struggle. And they also really struggle to explain it to their family members. People think, but you're lazy, man. Just get up or get some sleep, get a rest, get a holiday. You'll get over it. It's far more than that, isn't it? It's a deeper type of exhaustion where you feel tired. Even if you wake up in the morning, you feel tired. You're chronically fatigued, as we sort of put it. Then there's also a lot of emotional deregulation that happens during a time of burnout, where people really struggle to find the energy to be able to cope with parts of their emotions. Now, generally, dealing with life and dealing with people takes a lot of energy. Yeah? I mean, people can be draining, uh, going through life take draining. When people are presented with burnout, finding that energy to regulate your emotions becomes difficult. So it looks similar as depression. So people can feel fatigued, they can feel irritable. Depression is not someone sitting in the corner crying. Depression is more sometimes feeling irritable, don't have the patience like I used to have, dealing with people now feels very overwhelming. And then there's also quite a big impact on executive functioning, meaning people that had previous skills find it now hard to think, to sometimes forgetful, to be able to talk to people now becomes difficult. Planning, organization, where previously they could plan, now they sort of struggle with all this organizational things. They also have a reduced tolerance for stimulation. Sensory processing issues becomes harder. When we don't have energy, it's very difficult to deal with all the sensory processing issues in general. And when you're sort of running low on it, it's also very difficult. So we get a lot of social withdrawal. People try to isolate themselves, don't got the capacity to want to deal with people. Having to interact with people becomes harder. People are draining, having to make small talk, having to interact, having to work, having to connect with their family, colleagues. All of that starts feeling much harder. So it's a combination of a lot of things. It presents very much like depression. So we treat it like depression. It's different to neurotypical burnout, where the origin of it, where it comes from, how it works, how to work with it, and how to treat it becomes also very different. Yeah.
Thank you so much for that answer.
Mm,
Appreciate it. Um,
sure.
Another question is kind of a more general question about your approach, which is what does it mean to you to use a neurodiversity affirming approach in your work? And how specifically might you work differently from what's perceived to be typical clinical care?
Mm. Kevin, do you want to?
Yeah, I think what we do very differently is kind of set up the sessions number one in a very specific way. Um, like for instance, with the neurotypical, you might start off by saying, what's the problem? And for me, I think when I've tried that, when I first started working off with neurodivergent people or individuals on the spectrum, it was a bit too vague for them. So they really struggled with that. It was too general. So you have to be pretty, specific in a way with them to say, look, what is the problem you want help with today? And here's the problems that we could address. Here's the problem areas that that the session could help you with today. Is like, is it an emotional or feeling problem? And then give them an example. Is it a relationship issue? And then give them an example of that. Is it a issue with the trauma? Again, an example. Um, is it an issue with a bad habit or an addiction? So you give them that you just got to be a bit more transparent and a little bit more specific and detailed about what exactly they want to work on, or what the problem is. Because if you're too general, then they'll struggle a bit. The other modifications we use, I think, they center around just being open to, how they would like to work. Some of them, if they're coming in face to face, are they okay with the level of light in the office? We can draw the blinds, put the light up if it's during the day. I use a warmer light in my office. You know, if they don't want to have the camera on, for instance, when we're doing a session, put that off, and we can just talk in that way. Or just sometimes it's just over the chat box. They're having that sort of day. So it's about being open and accommodating to some of the needs that they really have. Saying that though, I mean, it probably, again, I think a lot of times what happened with some of the people that come to see me that are on the spectrum is that they've been that child or that adolescent was told, like, you ask too many questions. this child, like, like he questions me or she questions me all the time. And they've sort of learned to inhibit that in a way. And I think what I try to do is invite the people that come to me to ask questions. I ask them, like, listen, if you have any questions, please bring it up. How helpful did you find the session today? What was helpful? What was unhelpful? Any questions, during the process. So I invite the questions, and I try to answer them as honestly as I can. If they're a personal question, I'll try to answer it as honestly as I can. If I don't know something, I'll say, look, that's an interesting, it's an interesting take on that. I hadn't really thought about that in any way, but I will give it some thought and come back to you because, I won't always have all the answers. So that's just some of how I might work differently, I think, if someone was coming to me that was neurotypical, yeah.
Yeah, thank you. That's an extremely helpful overview, and I very much relate to the first point you made about how specific questions can sometimes be really helpful. Personally, as an autistic person myself, I find the question, how are you, to be, it's a great
Mm.
question, but it's so general. It's like, how are you today? How are you, over the span of your life? There's just so much potential ambiguity to it, and specific examples can be really helpful for preventing that overwhelm, I think.
Mm.
Um, One kind of related question is, are there specific therapeutic modalities that you found to work especially well, or that tend to not work as well for autistic individuals?
Yeah, look, they are. I have to say, we're still very, very much at the infancy level at this stage. But I think, dialectical behavior therapy, or DBT, is showing some very promising results in the research literature. But we're still very much at a early stage of it. DBT works really well because what it targets is emotional overstimulation and sensory hyperreactivity, which is two things that individuals on the spectrum might have. So why it works so well is because sometimes when a person with ASD is overstimulated, the emotional arousal goes up at a very high level very quickly. And that's where you get maybe a meltdown happening. So it goes up very quickly and it stays there for a lot longer, and it takes a longer time for that to subside. Whereas with the neurotypical, usually what happens is they have the emotional arousal goes up and then it's down very quickly. So what DBT really does is give them skills so that they can so they can come down a lot quicker. So that the emotional arousal or sensory overreactivity can reduce or subside a lot faster. And I think a skills training module like emotion regulation has been really helpful for some of my clients, teaching them the function of emotions. The latest DBT manual, which includes a component or a technique called radical acceptance, I think they've really done well in revising that, because now what they've done with radical acceptance is provide a step by step by step by step instruction on how to do the technique, and what to do to troubleshoot if you're having some difficulties with it. So that's really helpful for individuals on the spectrum, because here's the instructions step by step. We work through it step by step. You know what's going to happen. It's not vague. It's not open-ended. You have a real idea of what to do. Again, the other couple of techniques that I use is like half smile or open hands. And half smile is a really nice one because it will guide you were talked through again, step by step, how to do the facial expression, how to do the muscle work and stuff. And so it's very helpful, I think. So definitely DBT has been, shown to have some very, very promising results. I think the modifications that are coming in very new now is like a needs analysis. Whereas that's not part of the standard DBT approach. And a needs analysis is like we have a needs wheel that we give to the patient, and they then can identify, well, what are my needs here? Is it sleep? Is it a need for my special interest? Is it a need to withdraw? And that's really important because sometimes clients that are on the spectrum don't often know what their preferences or desires are. They've been so focused on not hurting others and fitting in, they don't often connect to their own desires. So that's been a recent modification in DBT as well. That's been quite helpful.
Yeah, thank you very much for that answer. And I'm also really eager to see, I know there's some research ongoing on adapting DBT for autistic individuals, so it's really neat to see what they'll develop in the future.
Maybe I can just
I mean,
add as well. I think it's it's taking a lot of the therapeutic models we have at the moment and adapting it. Cognitive behavioral therapy has shown that it has some sort of value, but it's got to be applied very differently. You got to have that understanding of neurodiversity. We start the cognitive behavioral therapy can work, for example, with overthinking, the obsessive thinking process as well, how to deal with some of the emotions. But again, it's got to be applied differently. We use it differently, we apply it differently. Um, a typical neurotypical model does not work. When we work with interpersonal therapy as well, and we do sometimes couples counseling or family counseling where we bring the family in, it's far more trying to understand the different worlds, how it works, how the thought process work, trying to explain what is neurodiversity. So the moment you work with diversity by itself, people have to think differently. They have to approach it very differently as well. Now, this comes with experience, many years of working with it as well. I think at the beginning, when we started specializing, we had to adapt quite quickly in terms of being far more straightforward. You catch yourself going into the neurotypical mode and you sometimes lose people. So it's really just taking what is at the moment and really just adapting it. I don't think it's have to be completely new models that have to be reinvented. I think it's just got a basis of understanding neurodiversity and then taking what works and adapting it to neurodiversity in general.
Yeah, thank you very much. That makes sense. And I think a lot of it is just based on
Mm,
kind of deeply understanding neurodiversity and then maybe
sure.
intuitively adapting from there. And that sort of leads into my last question, which is, I know previously we had discussed your work with environmental adaptations. Would you be willing to describe what environmental adaptations are and how you work with patients to kind of understand which environmental adaptations might be helpful for them?
Okay, so that's got to do with a lot to do with the burnout itself. Okay, autism burnout, um, the adaptation, how do we treat people, and generally when they present with it, and some of it. So one of the first things that we can change, and the easiest to change, and the quickest to change, is environment. And with environment, we mean by your work environment. How do you adapt to your work environment? With that, we talk about reasonable accommodation. Now, most companies in the world subscribe to the World Health Organizations that has got very specific guidelines on how reasonable accommodation should be done in the workplace. For example, we would then disclose it. The people would then work and the person would have a meeting with his manager explaining what are the unique needs are in the workplace, what are some of the sensory processing issues or the workload or the people? Um, or nowadays, a lot of them work far more remotely. They can work from home or they can sometimes come into the office. But it is really just sort of educating the workplace, how people work in the workplace, what are some of the needs that the individual have that can be different, and then how to sort of accommodate that in the workplace. And that has got a lot to do with sometimes we do a lot of talks. I do a lot of talks with companies as well. We explain to them what is neurodiversity, how do you deal with a neurodiverse workforce, how do you work with integrating that people into the workplace that they can be accepted, not stereotyped or being marginalized as well. How can they be included? And then obviously environmental adaptability in terms of environments at home, where you can then work with the partners, the family. What can the family do to support them? How do they understand, autism as well? So that's environmental adaptability. It's one of the quickest, fastest ways where we can really, help the individual. But then, also because we're psychologists, we work also on an individual basis. And this is where there's almost like what we call a neurodiverse psychology that we sort of focuses on more. And that is, understanding neurodiversity, what is it, how does it work? Now, on an individual basis, it's a lot we can do as well. I know that there's a lot of strengths that people have that's on the spectrum, and there's nothing to be fixed here. There's nothing to be have to fit into a neurotypical world. But what we've noticed is that when people spend a lifetime on the spectrum, very often there's quite specific thought patterns or thinking behavior that they've developed over the years. that are now leading to a lot of burnout as well. So we're also trying to focus on individual neurodiverse psychology besides the environmental adaptability, meaning what are some of those bad habits or thinking patterns you've developed over the years as a consequence of being on the spectrum? For example, if people live in a world where they feel they can't be trusted, they don't fit in, they develop habitual individual thought patterns of overthinking, of overanalyzing, of sometimes not trusting people. It can impact on their self-esteem, their identity. So that is also quite a big psychology that we work with, on an individual basis, like unmasking, trying to rebuild parts of your identity of if you've had a habitual process of thinking over the years in a very specific pattern. Now, that's overthinking, that overanalyzing, questioning people, ruminating about conversations all the time can be extremely draining on people and can lead to burnout as well. So we work with unmasking. How do you deal with neurotypicals? Which is a big skill as well to have. Now, neurotypicals, like I always say, it's not always right. They think they're always right. But this is not about who's right and it's about wrong. This is about understanding parts of those worlds as well. We work a lot with managing expectations of neurotypicals. And the thing is, as well, by maybe a little bit more disclosing in terms of being autistic and being on the spectrum, it also helps developing the expectations of neurotypicals. Because neurotypicals, I always say, it's giving them a fair chance. Because if neurotypicals don't know what they're dealing with, they struggle to deal with it. I always say, you assume neurotypical until proven differently. So people meet you and they think you're neurotypical, so they want to treat you neurotypically. And very often people that have spent a lifetime on the spectrum and haven't disclosed anything would want neurotypicals to understand them, but they don't. And neurotypicals has got this thing, if I don't understand you, I'll put you in this little weird box. I don't know how to deal with you. But that's not giving them a fair chance as well. Because the moment we explain to them what is autism, I am autistic, I'm on the spectrum, I've got attention to detail, I struggle to read social cues, they will understand. And neurotypicals are far more understanding than what we think they are. Because if they know what they're dealing with, then they learn how to be able to deal with this. And very often people spend a lifetime of spectrum not disclosing, struggling with relationships, and not always giving neurotypicals the benefit of the doubt for them to understand themselves. So that's quite important, working on a personal level in terms of that. Dealing with demands, we find that people that's on the spectrum, spending a lifetime on the spectrum, feeling like they don't fit in, they overcompensate and put a lot of demands on themselves, where they feel they're very demanding on themselves. And very often they say to me, Sean, the world demands this or the people want me. And it's not always the case. It is sometimes demands that they put on themselves to be quite perfectionistic, to be high performers, to have high work ethics. And they work very hard to try and fit in. And very often there's a little bit of overcompensation for spending so much time on the spectrum trying to fit in and not understanding the reasons why you're different. So they put a lot of demands on themselves. And that can also lead to a lot of burnout. And people sometimes do it unconsciously. They don't even know that they are putting these high demands on themselves. So it's a lot about understanding neurotypicals, how they work, why you are the way you are, and what the differences are. And I always say it's always very much in the detail. And neurodiversity's got a lot to do with detail. People in the neurotypical world often ignore a lot of detail. They jump to conclusions. In the neurotypical world, a lot of gray areas. People do a lot of guessworking. It's hard work sometimes in your typical world as well. You have to read between the lines, and people that's on a spectrum like the detail. They like to focus more on it as well. So it's really just merging parts of these worlds. And if we understand more about the thought patterns, about the self leading up to it, it can also help a lot with burnout and being able to identify what are the energy drainers on a personal level. What's draining me? Thinking, overthinking, overplanning, overanalyzing very often drains people a lot. Demands that they put on themselves, trying to cope in a neurotypical world can be extremely demanding. So we also work with a lot of individuals, besides all the therapies that we use. It's on an individual basis and for people to try and understand what is draining me, why is it draining, do I still need to mask? How can I be a little bit more myself in a neurotypical world? And also, how do they think and how do I work with neurotypical? So I think it's a combination of a lot of therapeutic models that's adapted, but also quite a lot of individual neurotypical work, understanding what is neurodiverse psychology and what habitual thinking has led them up to this point.
Yeah, thank you
Yes,
so much.
that answers. Still a lot I can talk about it, but I think time-wise, I mean, autism burnout is a massive topic,
Yeah.
So yeah,
It's a fascinating answer, and especially the part you mentioned about thought patterns and giving people the benefit of the doubt. I think that in itself is such a fascinating topic because the thought patterns and like that suspicion, I think it does come from somewhere, as you mentioned, like people often feel excluded and maybe they gave someone the benefit of the doubt and it didn't go well. But then
yes,
there can be like the over correction, which can end up hurting the person if they then become isolated due to fear. So yeah, thank you so much for that really interesting answer.
it's maybe just to add on to that, it's got to
Yeah.
do with trust.
Mm,
Do we trust people? And people that sort of spend sometimes a lifetime got hurt and become very suspicious about people, and do you trust? And I
mm,
always say trust works both ways. I mean, if we really read and can really understand people, we know if we can trust them. So sometimes I say we don't trust ourselves and our own ability to be able to analyze people, and therefore we might not trust them. So very often when you do work on the self, and that's what we concentrate on as neurodiverse psychologists, focusing on yourself. So if you understand that trust works both ways, also because I don't trust myself and I don't trust my own analysis of people, therefore I think I cannot trust people. So trust works both ways. And that's what you have to work with as well. There are people that can be trusted. And I don't say we just trust everybody. But trust issues and questioning people sometimes is also because I don't trust myself, analyzing people, the ability to trust people as well. So there's all these little patterns that develop over the years that we try to address specifically to adults over the years that they've developed.
yeah.
So
Thank you. And thank you both so much for your time. I really appreciate it. This has been really
thank you
fun.
for having us. Thank you for having us,
Having
and
Thank you.
thank you. Thank you, Sam.
Thank you so much.